We are privileged to have you. We thank you so much for considering us among the institutions around. It's not only YMCA, which is in the center of Kampala, but you've given us this opportunity.
We are here because the HIV epidemic, the burden is still great in women.
There's nobody who is going to protect you but yourself. We are depending on you as the youth. We are aware of the vulnerability that you have, but we want to commend and thank YMCA because it is addressing one of the issues that causes vulnerability. Lack of skills, having a means of earning income.
This day, International Women's Day, we actually are celebrating or commemorating the Day of Women. And in particular this year, as AIDS Healthcare Foundation, we are focusing on young women and adolescent girls. We want to talk to them about HIV, how to prevent it, how to take care of themselves, how to protect themselves, but also for anyone who could be HIV positive by any chance. We want them to know that medicine is the only key to their health. We think that this is the first time we are having to penetrate such a community of young people because we basically want to have a team of ambassadors who are out there speaking out to their peers, letting them know about HIV prevention, letting them know about HIV care.
What our students benefited from this program was they learned how to prevent themselves from getting HIV, on the protective measures, and they taught us how to use condoms, and even we got chance of getting female condoms because some of us had never seen condoms, female condoms, but today we got the chance.
Whereas there is a clinic here that provides HIV counseling and testing service, we have also learned from the students themselves that I think they are most comfortable with an external person whom they do not know to conduct their HIV test and let them know the results. They are a little uncomfortable with their own facility. And so for us, as a service provider, this is when we come in and this is when we think that we are offering, some value addition rather than have children shy away from a service because they know the service providers. Then we can come in and always complement and supplement what the school has.
Mu ggwanga lyaffe Uganda abatami bakyasinze ofuna siriimu.
Omuntu ayinza kwerabira akapira ne kamubuliramu.
Is this lubricant not so effective on the human body, particularly the private parts?
What is taking place right now is this is a community outreach that we basically staged on International Women's Day, and basically it's for empowering women within the community. Such communities have women basically who are prostitutes, we have maids who are engaging in risky sexual behaviors. So we basically had to bring in free HIV testing services. We had to teach them on condom use. Especially much emphasis was put on female condoms, and this is an approach that we believe that all women need to access, as well as being empowered on issues of HIV and AIDS. We are trying to educate them on the correct and appropriate use of female condoms, because you find that majority of women are biased, have perceptions, have myths on female condoms. So we've been basically doing demonstrations, answering different questions about female condoms, and this helps majority of the community members and the women themselves to basically have enough information about the use of female condoms, because you find that majority of women are very vulnerable. They're at a higher risk of getting HIV and AIDS. The fact that majority have lesser chances of negotiating for safe sex. This particular day is a great opportunity for them to get this information so that they can have better confidence and self-esteem. So we are working in partnership with Uganda Cares, one of the HIV service providers, to conduct such activities. In this case, we had to engage the local community leaders who did the community mobilization on our behalf. So we believe that such an opportunity as International Women's Day gives a platform for advocating for better strategies of HIV prevention, especially among women in Uganda.